Healthcare in retirement is one of the biggest expenses you'll face, but how do you cover those costs, especially if you're not eligible for Medicare? Tyler's going to join me today. We're going to break down your options before and after age 65. Hey, if you're planning for retirement, don't miss out on our other videos. We talk about things like Social Security, tax planning, and generating income from your assets. Be sure to subscribe to our YouTube channel. That's at Commonwealth Financial. And if you would like to learn more about us, visit cfswd.com. So, Tyler, let's start with the gap years. That's before you turn 65. Tyler, what are people's options if they retire early?
This is one of the biggest hurdles that we ultimately run into whenever we're doing planning, retirement planning for our clients. One major option is purchasing individual healthcare through the ACA marketplace. It's also known as Obamacare. Plans vary widely in cost and coverage. Without tax credits, premiums can be high, especially for those in their early 60s. But many retirees qualify for premium subsidies based on income.
So income planning and planning how you accumulate assets is going to be huge in this, right?
Exactly. By managing your taxable income, say through Roth conversions, asset drawdowns, or timing Social Security, you may stay under the threshold for ACA premium tax credits, which could save you thousands a year.
So what about out-of-pocket costs for these types of policies?
That's key. Even with a subsidy, Neal, you still have deductibles, co-pays, co-insurance to consider. The ACA does cap your maximum out-of-pocket expenses or costs, just over $9,000 for an individual in 2025, but still, it can be a big chunk of your budget.
Yeah, and a lot of people are used to those higher deductible plans now that maybe were 20 years ago. So that's not necessarily an uncommon thing that we see these days. COBRA is often a question that people ask us. How does COBRA work? What are we looking at there?
COBRA lets you stay on your former employer's plan for 18 to 36 months, but you pay the full cost, often over $1,000 a month per person. Some retirees use it for a short bridge before switching to ACA coverage. Others may have access to a spouse's plan or take on a part-time job or work with benefits to close that gap.
Yeah, I think that's an important thing, the part-time work, that if you can just work 25, 30 hours a week and get some sort of health benefits, it can be worth the hours you spend doing that from what we've seen if you can't stay under that ACA. Tyler, in your area, what are you seeing if people have to go out and buy their own insurance and they're not really trying to do the ACA thing? What kind of premiums are you seeing up in the Wheeling area for those types of coverages?
Typically, private insurance, Neal, we're looking at anywhere from $1,000 to $2,000 per month. I've had a couple clients that went out age 60, so about 5 years before they could get on to the Medicare, and we were looking at about $1,800 per month for just the health insurance expense, Neal.
Yeah, it's about the same here. I've seen it as little as maybe $750, but again, the deductibles on those policies are huge. And if you're healthy, that can work out, but it's still going to be a big number, regardless of where you are. And maybe in larger metro areas where there's more competition, you might find something a little bit better. Let's shift gears now. And when you get to 65, we all qualify for Medicare, or at least the largest majority of us will qualify for Medicare, but Medicare doesn't cover everything. What are some of the things that people do to help manage the costs there?
The original Medicare covers hospital and doctor visits, but you're still exposed to deductibles, co-pays, and no cap on out-of-pocket expenses. To fill that gap, most people add either a Medicare Supplement, also known as Medigap plan, or a Medicare Advantage plan.
So just a quick difference between the two. A Medicare Supplement tends to have a monthly premium that's involved. And sometimes they're anywhere between $100 to $150 a month. And depending on the plan you take, and they have different letters, it will cover various things. Medicare Advantage plans don't work the same way. They basically take place of your Part B. The insurance company covers starts collecting that Part B premium, and you may find that you don't have out-of-pocket costs, but they do include some other things, don't they, Tyler? What are some of the things that Medicare Advantage plans might have?
Yeah, Medicare Advantage plans often have lower premiums, include drug coverage, and may offer extra visits, or extras, I should say, like vision or dental insurance. They can also have higher out-of-pocket costs, and the networks can be more limited to just regional doctors. So they control who you can go see as compared to the standard Medicare plan.
Yeah, so Medicare supplements, typically if you are a little bit unhealthy and you have a lot of things coming up, a Medicare supplement may be a better plan because your out-of-pocket costs are going to be somewhat minimal depending on the plan you take. Whereas a Medicare Advantage plan, you could be looking at, you may not pay that premium, but you could be looking at $4,500 or more of out-of-pocket costs depending on how that plan is structured. The downside of the Medicare supplements is they don't include prescription coverage. You'll have your Part D plan on that as well to add into that. So there's a lot of analysis that goes on with that. And where you're located is also going to be a big driver of that as well. Those Advantage plans are network dependent. So if you're in a remote or rural area, you may not have as many options for that to get care, or the doctors you're accustomed to using may not be part of that network. So that's something you have to really watch in those regards. A Medicare supplement typically does not have those restrictions. And we have some folks here at Commonwealth who can really help you break that down if you want to dig into the weeds on that. Tyler, healthcare planning is just one part of a successful retirement strategy. Do you have any final thoughts on this today?
This is, again, Neal, one of the what I call hurdles that we face here whenever we're doing retirement planning for our clients. Most people have the funds to retire early before Medicare, but ultimately it's do they want to have that trade-off and spend that extra money on a premium or a higher deductible plan through a private insurance, or try to go the ACA route in order to kind of budget until they get to age 65 for Medicare. So it's one of those things that we definitely want to drill down into and look through by financial planning.
So let me ask you one final question here. If you're working with someone who's in their early to mid 40s or even in their 50s, how does your advice for accumulation change if you're looking to, or if that client is looking to rather retire at 55 or 60?
One of the best routes that I try to look at is HSA plans, high deductible plans that offer the HSA savings route for those 40 to 50, or even into the 30s, to start accumulating some tax-free money inside of an account so they can afford to potentially retire early and have that HSA offset those premiums or the healthcare costs. That's just one route that we try to look at in order to do so. But health insurance costs are one of those costs that have continuously rose here over the last 20 to 30 years, and for the foreseeable future, it looks like it's going to continue forward. So a good plan in place and an early plan in place is the best thing that our clientele can do.
Yeah, and the other side of that, I think, is to also build some tax diversity in your planning. So if you're accumulating outside of a traditional 401k or traditional IRA and using maybe Roth assets or even just taxable accounts, an individual or joint account gives you the ability to manage your taxable income. So if you need to plan for those ACA premiums or trying to plan for those ACA premiums, you have some flexibility in the assets that you accumulate as well. Thanks, Tyler, for joining me today. And if you like this episode, give us a thumbs up. If you need some more information about how to help plan for that expensive health insurance pre-65, or even what your options are after 65, you can reach Tyler, myself, or any of the members of our team at our website. That's cfswv.com. Thanks for watching. Have a great day.